Good morning, everybody, and welcome to this Timewise webinar to take you through the results of our Flex for All survey and project. My name's Claire Campbell, and I'm delighted to be your host for this morning. If you haven't come across Timewise, we're a social business. Our work is all around ensuring equal and fair access to flexible work. We work with employers across a whole range of sectors and to unlock more jobs to flexible working, to worker choice, to worker control. And hopefully good outcomes for the workers. So over the next hour, we're here to share the results of our Flex for All study, hear from some of the researchers who supported it, hear from some of the employers who participated, and draw out what we can take away from this project as learning for those of you who are trying to implement fair and flexible work in your own organisations. And it feels like a really great time to be sharing this project. We have, as we all know, a new government who's made a commitment to improving the lives of working people. We should hear tomorrow about the New Deal for working people. We're expecting it to include commitments around fairer worker rights, tackling things like exploitative zero-hours contract, and of course, flexible working as a default as a day one right. So really interesting time to be having this webinar. The project was conceived back in 2022 before we knew about the potential changes ahead. Many of you will know Timewise has led pioneering work over the years in a range of kind of hard to flex sectors. And that's brought us huge learning, huge kind of range of different ways that we understand to implement and intervene and work with workers to change their experiences. But we know there are still more to go and there are sectors that we haven't touched, and there are plenty of organisations still to embark on this journey. One of the frustrations in some of our earlier projects was it was difficult to really understand the impact, and particularly the longer term impact of some of the interventions we were making. It is challenging to undertake long-term research with workers. People change, HR systems may not have the data, but it was something we know it's so important to build the evidence base, build the understanding of why these kind of interventions matter. So we embarked on this project. We set out from the start not only to implement flexible working interventions, but to work with the Institute for Employment Studies as a partner to help track the impact on workers and track the impact on their organisations. We were lucky enough to have support from Impact from Urban Health, who've been a great partner with us, and we reached out to 3 employers who we knew were already on a journey with their own flexible working agendas. They were Guy's and St Thomas's, Wickes and Sir Robert McAlpine. So to tell the story today, I'll introduce our range of speakers. Firstly, you will hear from my colleague, Dr. Sarah Dauncey. Sarah is our Head of Partnerships and Insight and has led the project from the Timewise side. You will then hear from Astrid, who is Astrid Allen, a Senior Research Fellow at the Institute for Employment Studies, and has overseen the evaluation and been part of the project right from the start. We will then hear from 2 of the employers who've been on the journey with us. Louise Tait is Director of People and Inclusion at Wickes, and Andrea Williams-McKenzie, Deputy Chief People Officer for Guy's and St Thomas's. And we're really delighted they could both join us today and share their story. Our final speaker is Benjamin Franklin, Ben, who is the Interim Chief Exec of the Centre for Progressive Policy, and will really help us be able to put the story into the wider context and think about what we can draw out and how we can kind of cascade this work and help it have a longer term impact. We should have time for questions at the end, so please feel free to use the Q&A or the chat functions to kind of log anything you're interested in finding out more about, and we'll take a few questions when we've got time at the end. We'd love you to tweet and share during the event, after the event, so use the hashtag #FlexForAll, the name of the project, and then we will be able to see your messages. Just before I hand over to Sarah, we wanted to just nick this opportunity to understand and gauge your thoughts on the upcoming legislation around flexibility by default. We know there's a lot of support for this as a concept, but also some questions about how easy it's going to be to implement from businesses and from business lobby groups. So we just wanted to take this opportunity to do a very quick poll, which we'll bring up now, just to get your views on flexibility by default. So the first question is, yes, the government should act fast to deliver on its manifesto commitment on flexibility by default. And the second one is whether will it be difficult to realise in some roles in my organisation? Be really interested. We'll just leave that running for a few seconds.
Answers are coming in thick and fast, so I'll just leave it for a moment.
Ilona? Yeah, I mean, we're waiting to see with interest, I think, how easy this will be. Okay, so yeah, interesting. So most agree it is a priority, but yes, not everyone feels it's going to be easy to realise. And I think, yeah, that sort of reflects our understanding that, and I think, to be fair, the government's, there's going to be consultation on this to make sure that it's workable, but really important to see what we can do. And I think that message that workers can expect more protection and more ability to get the flexibility they need and deserve. So great, with no further ado, I want to bring in my colleague Sarah, who's going to introduce us to the aims and shape of the project. Over to you, Sarah.
Hi there, it's really great to be with you all today and to have this opportunity to share insights from our programme, Flex for All. So if we could move on to the first slide, please. I'm just going to quickly run through some of the context for this programme. Why did we undertake it, and why did we build the partnerships we did to make the programme possible? Do any of these headlines resonate with you? Do you remember them? They are in the news often. Hybrid working hits the news because of the benefits it brings for workers. Recently, articles have referred to studies showing that hybrid workers are happier, healthier, and less stressed. Well, it's of course great to hear that and to know that there are models of working that bring improved outcomes for employees. It's important to remember that remote and hybrid options remain relatively exclusive and depend on job role, and too often also on role and level of seniority. For the majority of workers who have fixed locations, hybrid and remote working isn't even an option, and this has significant implications in the context of health equity too. So this inequality in access to place-based flexibility plays out within organisations too, with differences in ways of working leading to experiences of exclusion and of course also a sense of unfairness. Undoubtedly, this impacts on employees' experience of job satisfaction, retention, and their health and well-being too. So it's for this reason that we joined forces with the Institute for Employment Studies, Impact on Urban Health, and the 3 trailblazing employers that Claire introduced you to. We work together to introduce flexibility into hard-to-flex frontline and site-based roles, and in order to reduce organisational disparities. Now, it's important to quickly look at the labour market context for this too. As Claire has already mentioned, this was designed and emerged in a post-pandemic context, but relatively little has changed. And again, these are all key points that constantly hit the headlines, especially economic activity. This figure has risen, and it's a distinctive feature of our labour market, and it is partly driven by poor health. When you include unemployment figures, currently about a quarter of the people of working age, that's around 11 million people, do not have jobs. And so flexibility is a key part of the solution that the government is looking to with local authorities and with employers, because all the evidence is currently indicating that good quality flexible work has a big part to play in the solution to this economic activity problem. Crucially, when we talk about flexibility as a feature of good work and health equity, we need to think about race and ethnicity and adopt an intersectional lens. Occupational segregation is also a distinctive feature of our labour market. Workers from some minoritized and ethnic groups are overrepresented in sectors where frontline and site-based work is prevalent, like retail, hospitality, and health. So this issue is therefore a matter of social and racial justice too. And finally, I want to pick up on the issue of job insecurity. We have rising rates of insecurity, and there's evidence to indicate that the lack of flexible employment is pushing people into precarity. While this is predominantly a feature of low-skilled work, it isn't exclusively so. And recently in the news, we hear about teachers increasingly moving into supply, nurses moving into bank too. This is, again, a feature of our labour market that this programme of work was looking to address. So if we can move on to think about what we did, well, we collaborated, but if we could move to the next slide too, we've mentioned our partners involved in this programme. So what did we do to tackle this workplace and health inequity? Well, the programme falls roughly into sort of three parts. Firstly, we created a set of guiding principles in collaboration with our steering group that was made up of sector leaders and leaders in our participating organisations. And these principles were devised to guide an organisational-wide approach to flexible working and to address organisational inequalities in ways of working. We then collaborated with Guy's and St Thomas's, Sir Robert McAlpine and Wickes to set objectives and to co-design activity to introduce flexibility into site-based and frontline roles. And that activity looked very different in each of these three organisational settings. Guy's developed a roster pilot to increase input and control over shifts within one roster group within the acute admissions ward. Sir Robert McAlpine focused on educating and supporting senior leaders and managers on the value of flexible work and how to implement flexible options within site-based teams. Wickes expanded an existing pilot and gave flexible options to 3 store manager roles. And finally, with IES, we tracked the impact of flexible working on individuals and organisations. So I'm now going to hand over to my colleague Astrid to discuss the evaluation findings.
Thank you. Thanks so much, Sarah. So I've got quite a few slides to try and whistle through here. But first of all, I just wanted to say that this was quite a broad-ranging evaluation. As Sarah said, we had 3 different approaches and we took wide-ranging forms of evaluation as well. We did some surveys at the beginning of the interventions and then surveys just following the interventions. We also gathered some HR data from the employers, and we also did some interviews and focus groups, which were really helpful to kind of put meat on the bones and understand what was really going on in these organisations. So moving on to the next slide, I wanted to just first of all give you a sort of sense of the kind of things that we looked at, but to give you a bit more detail initially on health and well-being. We asked beneficiaries to what extent they agreed or disagreed with the statement, "My current working arrangements allow me to maintain a good level of personal health and well-being." And on the next slide, you can see this in a graph form. At baseline, we found that just over half of respondents felt that they did agree with that statement. And when we actually asked the beneficiaries at the end line, we found that 82% of beneficiaries agreed. So a changing picture there, first of all, on health and wellbeing, that was quite significant. Moving on to the next slide, we looked at, had these conversations with individuals, and this was one of the bits of feedback that we got. I just won Store Manager of the Year at Wickes, but my home life wasn't great. My daughter was 3.5 and my other was newborn. My wife was really struggling. She needed to go into work 1 day a week. We had little time together. I took the opportunity at my performance review to say I needed to make a change. Then the trial was presented to me. To me, it was a no-brainer. So it just gives you a flavour of kind of what this meant to people in real life. So moving on to the next slide. We also looked at job satisfaction, and this was quite interesting. We found that 83% of beneficiaries at the end of the pilot felt that their new flexible working arrangement had increased their level of job satisfaction. But it wasn't all roses. There was some difficulties that people experienced through the pilot. There was instances of, we asked questions around conflicts, and there was some reports of some conflict with teams, with managers. So it was a tricky thing to do within the context of these sectors. And also work intensity was another thing that came up. Whilst I think it was 22%, let me just check my notes, yes, 22% of beneficiaries strongly disagreed that the new flexible, their new working approach had led to job intensity, increased work intensity in their job. There was a small number who actually did strongly agree that it had. So 7% of workers actually agreed that it had, which may be reflected in some cases where we had compressed hours and indeed reduced overall number of working hours. So effectively, more work was being done in fewer hours. So perhaps not totally unsurprising, but we didn't see such a massive change in job satisfaction when we asked that question from the beginning of the intervention to the end of the intervention, but some improvements. So if we move on. Again, another nice quote here: the more control people have over their working pattern would generally make people happier. Everyone operates differently and people need different rest times. And that just kind of sums it up from a staff nurse there at the hospital. And again, next slide. So what was in it for organisations? We looked at a range of factors here, and I'm going to focus in on, first of all, job retention. So next slide. Whilst we were unable to look at job retention in the timeframe of this pilot activity in terms of actually looking at actual numbers that left the organisation, we did ask questions around people's propensity to stay, and we got some really interesting results. At the very start of the initiative, we asked people whether they would take a different job with a better work-life balance, even if it paid slightly less. And we found that a good proportion of people did say yes to that. And indeed, 11% of male respondents shared that they had considered leaving their job in the last 3 months due to a lack of flexible or agile working. And that was actually 20% of all female respondents. This was at the start, before the interventions. So quite a significant, and I wouldn't be surprised if that's reflective of the wider workforce. At the end of the intervention, we saw 76% of beneficiaries agreeing that their new working arrangement made them want to stay with their employer for longer. So we saw some really positive outcomes. So moving on to the next slide. Performance, again, wasn't something that we were able to look at in great detail. Oh, sorry, just another quote here. Flexible working trial had made me appreciate my job more, and if possible, had made it even more loyal, maybe even more loyal to Wickes, as I have the best working life balance I'd ever had in all the years I've been working at Wickes. So another great quote. Moving on to the next slide then, please, on performance. So we did ask employees to self-report on whether they felt that their working arrangement had helped them to work in a more productive way, and 83% of beneficiaries agreed with that, but it was self-reported. However, when we had conversations with managers, that was corroborated. We saw some, I remember one conversation where a manager commented on performance measures improving or remaining the same. So some good positive feedback there about performance. And then finally, I just wanted to mention briefly about culture change. This was one of the outcomes from the project as well that we saw generated from the pilot activity. We saw changes in how people communicated and planned work. We saw investments in flexible working approaches through systems change. We saw teams being given ownership of how they work as flexibly and what can work, and those things were really critical to success that we saw in these pilots. So moving on to the next slide. no going back. So 81% of all respondents to our endline survey supported an organisation rollout of the piloted approach. And indeed, we have seen rollouts happen within these organisations. And finally, just wanted to mention that 84% of beneficiaries agreed that their new working arrangement was central to how they wanted to work in the future. And with that, I'll hand back to Sarah. Thank you.
Thanks, Astrid. It's really brilliant to hear what was wide-ranging findings distilled into about 5 minutes. So well done, Astrid. That's fantastic. Thank you. And that brilliant quote there to end from one of the participants of the programme who definitely felt that it led to a better way of working. If we could move to the next slide on recommendations, please. We've got a raft of recommendations in our report, so I do urge you to look at that. And I was really interested in the poll that we had at the start, sort of indicating quite a high proportion of people here sort of feel and are mindful of the difficulties of introducing flexibility into frontline and site-based roles. So these recommendations then are really important to be able to support organisations to create change and start a process of enabling their employees to have greater levels of input and control. We know that makes a difference to support their health and happiness. So these are kind of our sort of top ones from a much bigger list. Key is for leaders to really be driving the process of change, to see the value of flexible working, not only for their people, but for their organisation too. And clear accountability is required to be able to address inequalities and manage a change process. Engaging and empowering employee voice over ways of working, we found, was also a critically important part of the success of the pilot activity in each of the organisations. Ensuring that employees across the organisation are informed and are also instrumental to the design process. Create working environments and cultures where people feel able to talk openly about their working preferences. And this may include moving away from using the term flexibility. We use this term a lot. It's very much an umbrella term and has been part of our programme. But one of our findings is that in some contexts, typically the rota within hospitals, flexibility doesn't land as well as thinking about input and control over preferences and over shift patterns. So again, it's about finding a language, a vocabulary that works and is inclusive. Finally, of course, we would say this, we've just undertaken pilots, but they are important and they make a difference. And the rigorous evaluation of them is key to be able to build the evidence base and be able to bring people on board and develop scalable change and inform decision making. Before we move on to hear from our panelists, I'm really pleased to say we've got a very short video that shares some of the voices of the people that were involved in the programme. So we're going to quickly play this video for you, if that.
So a normal week is bonkers, I would say. I'll support my sister kind of looking after my 3 nephews. I look after my mum as a carer. Having to juggle so many aspects of your life, it can be difficult at times.
Previously in other retail positions I've worked in, the work-life balance wasn't so great.
We want to be part of this pilot to improve the work-life balance for all our staff.
We've seen a reduction in short-term absences.
I enjoy doing a mixture of shifts between nights and weekends. I try to give myself every other weekend off so that I can actually see the world.
For me, flexible working is the future.
It's changed my life massively. And now doing flexible workings, actually, my wife, she's in a job she loves now because she's got the opportunity to look at different jobs and go into what she wants. I can work around her.
Staff feel valued, they feel listened to and seem a lot happier.
So I'm very pleased to hand over to our first panelist, Louise, who very much led the work at Wickes and has a lot of learnings to share on how they developed the programme of work at Wickes. Louise.
Thank you, Sarah. Hi, everyone. So briefly, for those of you who don't know Wickes, we're a UK-based DIY retailer with nearly 8,000 colleagues. Majority of those are in operational warehouse roles or in our customer-facing roles in our retail stores. And the business case for flexible working at Wickes was really clear when you consider the sector that we work in. You know, over the last few years, the retail labour market has been really tough, with a lack of labour supply to keep up with demand. And with half of the people in the retail sector working flexibly, it really became a necessity for us to adopt flexible working to attract and retain great talent in such a competitive market. Internally, there was a huge opportunity for us to use flexible working to progress and develop our internal talent. At a colleague level, 40% are female and 40% work part-time. But these figures drop in our leadership layers. So we could see that we were missing an opportunity to really progress talent and build diverse teams. And there was also just an opportunity to support colleague health and well-being by giving them more control over how they manage their work alongside their personal needs. And, you know, we have a strong belief here that when our colleagues are able to be themselves at work, they'll go on to be more engaged and deliver a better customer experience for our customers. So when we partnered with Timewise on this programme, it was really to understand how do we introduce flexible working into customer-facing roles. We weren't starting from scratch. We'd already successfully rolled out flexible working to our support office teams, but our challenge was really about how do we think differently about flexible working, think about the art of the possible and give our operational leadership teams the confidence that they could introduce it within our operational environments without impacting business performance. Fast forward 18 months and we've now rolled out flexible working to all of our store leadership roles, and we've learned a huge amount along the way. And I'm just going to share 3 of those sort of key learnings with you. Our first learn was the absolutely fundamental importance of making sure our leadership teams were engaged and aligned around the business case for flexible working and how we go about implementing flexible working within Wickes. It was really easy for our line managers to connect with the argument for flexible working, but it doesn't actually help them then figure out what that actually means in practice. So our answer to that was to really establish a clear set of principles that describes what flexible working is at Wickes and also what it isn't, to provide some really clear guardrails. And these came out of really lengthy, really valuable discussions with our exec and our leadership team to ensure that everyone was really aligned and ready to sort of lead this piece of work. And our principles recognise things like there wasn't going to be a one-size-fits-all approach to flexible working at Wickes, and also that our senior leaders would have decision-making autonomy at a local level to agree those flexible working arrangements so that they could make sure that they were putting something in place that met the needs of the business and of the function and the individual. So practically for us, we have a set of organisational guidelines, and each function has its own organisational charter to work out what that flexibility looks like for them. And this really was, spending time on this part of the process really was so fundamental to ensuring that our line managers had the confidence to make those local decisions and make sure it was right for them and their teams. Our second learn was test, learn, measure, and then test, learn, measure again. So listening to what our colleagues wanted, testing and piloting really stopped us making assumptions about what our colleagues wanted from flexible working. It also helped us identify implementation problems, and it really built confidence in our line managers that this could work. So in our stores, our pilot showed that we really had some work to do on job design, on the way we scheduled hours in our stores, and on the routines of our store managers as well. And it also highlighted a gap in capability of some of our operation managers who report into our store managers. And we needed to make sure we gave them more training to allow them to step up and be confident leading the store team on what could be a more frequent basis. And we wouldn't have identified those things had we not piloted. And then the measuring of the flexible working pilot made sure that, you know, we could prove there wasn't an impact on business performance or on colleague engagement, but it also made sure we continuously reinforced that line manager confidence, which is so important in terms of being able to make those brilliant local decisions. And then our final learn is that you do need to be prepared to invest to make this work. You know, getting this right for us meant we spent 18 months trialing, learning, and then trialing and learning again. We've introduced new training, new scheduling tools. We changed the way we budget our stores from FTE to hours. And we've had to equip our line managers with toolkits and training that they've needed to have good conversations about flexibility, you know, and all of this involves time, resource and investment, but has been absolutely fundamental really to the success of our rollout. So we've certainly not concluded our journey. We launched flexible working to all of our store teams at the beginning of this year, and we will be continuing to learn from the implementation of that. And we're now starting to have a look at what does that flexible working look like in our distribution centres and figuring out what flexible means to them and how do we again pilot, test and learn in a different operational environment with different needs. That's it from Wickes. I'm now going to hand over to our next panellist, who is Andrea.
Thank you very much, Louise. And good morning, everyone. So just a little bit of information about Guy's and St Thomas's Hospital. We employ around 25,000 staff and we have sites across South East London, North London and Harefield as well. So quite a broad coverage within London and just outside London. We have been working with Timewise for the last 18 months, 2 years, and we're really grateful to the Guy's and St Thomas's charity that funded this work with Timewise. And so we welcomed the opportunity to focus on flexible working for our frontline staff. And as Louise has mentioned, our nursing community, which is our largest part of our workforce, is predominantly female. But I think felt that there was not a great deal of flexibility. And particularly as we emerged from the pandemic, it felt in the organisation as if it was a two-tiered organisation with your corporate services, non-frontline service-facing posts having much greater flexibility in working in a hybrid way, working remotely, home working, while our frontline facing workforce, particularly our nurses, had very little flexibility. And as we've read and heard about over the years, as we've emerged from the pandemic, a workforce that was feeling increasingly burnt out. So the timing of the pilot with Timewise was absolutely perfect for the organisation to enable us to focus on how we could enable greater flexibility in our frontline service. So as Sarah and Astrid have mentioned, what we've found is that better rostering can give our people, and particularly our nurses that were involved in the pilot, more input, control and predictability of their working patterns. So they could plan study days more easily and it improved their work-life balance. We also found that managers and roster writers can still balance the needs of the service while enabling staff to have more control and input. So some really important things that we saw as benefits. Some of the principles, very similar to Louise, was the need to balance the service needs and individual preferences. And we found that there was a need to enable a clear understanding that we had to maintain and balance the service requirements with the individual needs, and that's an ongoing focus for us to enable greater flexibility. We also found that specific rules could be built into the demand template that's used for rostering to ensure that we were meeting the service needs, and also ensuring that others can be added to that rostering template and rules to ensure that there was fairness as well as safety for our staff and our patients. And that we had to ensure that our teams were clear that some rules are fixed, but the teams can agree on certain other principles, such as number of requests that could be made around flexible working, and how we track the response to staff to ensure that that communication was consistent and clear, and particularly where requests could not be accepted. And in Guy's and St Thomas's, we piloted self-rostering and team rostering. So some of the benefits that we saw from the pilots, I mean, we piloted in our critical care unit and our acute admissions ward. And what we were so surprised by some of the benefits. In one area, there was a reduction in sickness of 99% in one of our wards, which is just phenomenal. But in all the areas that we piloted, we saw a significant reduction in sickness levels, greater levels of satisfaction and engagement from the staff in scope for the rota. As you can imagine, rostering around the Christmas period, holiday period, can be an absolute nightmare for our roster managers and our roster staff. But what they found is that rostering was much easier around the Christmas rota because they had the requests early on, and obviously they tried to accommodate as many requests as possible. It also reduced the amount of management time for actually writing rosters, so we were able to focus time elsewhere on the wards as opposed to just trying to balance the rosters. We had fewer complaints about rosters, so staff were visibly much happier, and there was little to-ing and fro-ing around communications around rostering. And we also found that there were benefits around retention, turnover reduced. We also found that the pipeline into vacancies within the units was much stronger. So before self-rostering, there wasn't an appetite to apply for promotion because the role looked very daunting. But actually, as a result of the pilots of self-rostering and team rostering, staff in these specific areas were applying for promotion. So they had a greater sense of being re-energized and replenished as a result of having more control over the times that they worked. And finally, just in relation to culture, we found that it improved communication, greater sense of inclusion and having needs met, and hopefully a translation of that sense of care and inclusion into the care that we provide for our patients as well. Now, we also revised our flexible working policy trust-wide. That was launched in March. We held webinars across our trust, promoting the new flexible working policy. And as a result of those webinars, we also included a focus on team rostering and self-rostering. A huge number of our nursing workforce attended those webinars. And we are continuing to pilot self-rostering and team rostering in 5 other wards, and we will continue to build on the great work that we have delivered so far. So that's the experience from Guy's and St Thomas's. I hope you found it helpful, and I'll now hand over to Ben.
Thanks very much, Andrea, and thanks so much for the invite to be part of this really incredibly important panel discussion today and report launches as well. I've been asked to set this event within the context of the macroeconomic environment and the broader national public policy landscape as well. Sarah kicked off by talking about the labour market challenges that we are facing in terms of economic inactivity and the 2.8 million people that are inactive due to ill health. That's people who are out of the labour force. They're not looking for work at the moment either. And this is a bit of an anomaly in terms of the increase that we've seen since the pandemic. So a lot of other countries obviously saw increases after the pandemic, but they are now back to pre-pandemic levels, whereas we're still at an elevated level. So this, to some extent, is a UK problem, although economic inactivity due to ill health is a problem right across Europe and the OECD countries too. But critically, it's not just a supply issue in terms of workers, it's also about productivity of those in work. If you've got ill health or multiple conditions, it's much harder to play an active role in the workforce. And some work that we've done as an organisation calculated that if you manage to reduce health inequalities between places, you could boost the productivity and output of the economy quite substantially. But this isn't just a problem for today, and obviously it is a significant macroeconomic problem today, but it's probably going to get worse in the future unless we start to understand how job quality and flexibility needs to play an incredibly important, increasingly important role. So we have an aging population, for example. You know, over 50s are the biggest growing contingent of our workforce. And it's the over 50s that may well leave the workforce early due to ill health, and we've been seeing that recently. Now, sadly, we've also got an increase in mental health problems amongst younger workers too. So it's not just the over 50s, but this is an issue that's only going to intensify over the coming 5 years and decades beyond that. So from a macroeconomic standpoint, and given the demographic challenges and trends that we face, good work and flexibility are incredibly important aspects that we need to be aware of in public policy as we go forward. Just in terms of the national policy landscape, so there are opportunities for change here, and obviously this event and the publication and all the work that's gone alongside it is a microcosm of the change needed across wider economy to really make flexibility the default option. But there are some public policy opportunities for change, and also I think there's a natural business case for change as well. So from the public policy side, obviously there's the King's Speech tomorrow, and we're going to see some interesting legislative changes on that front. For example, the New Deal for Working People, which may well see a return to some extent of collective bargaining, some more onus on flexibility from day one and enforcement to prevent the worst employer standards as well for workers. There's an interesting thing which I think has been slightly overlooked about the Department of Health and Social Care, and that's that they're going to have a bit of a remit for economic growth, and how that then feeds into labour market issues and challenges and solutions, I think is really interesting. And then the third part of the King's Speech agenda, which I think will be interesting, is around devolution. And as an organisation, we work with national and local leaders in devolved areas, including the big ones such as Greater Manchester and the West Midlands, to enable places to tailor skills and employment support offerings to workers. And we work with the North East, for example, on trying to support employability, particularly amongst the over 50s, where flexibility was identified as a really key issue. So there are some real interesting opportunities for change from a legislative point of view on that basis. But I think fundamentally what we're talking about here is a market-driven change. And what we've seen, I think what the poll demonstrated at the beginning of this session, is that there is substantial demand, and from employers, that is as well, to offer flexibility. The big question is, how do you embed it? And obviously this event and the work that Timewise and others are doing in this space are incredibly important in this regard. And some of the case studies and learning from some of the case studies we've seen today will be really important in terms of driving that shift in approach. I would say, however, obviously there's all these great opportunities and there are very clear business cases, but there are still very clear challenges that we face. 10% of the workforce are in very insecure roles. And while some of the case studies today are really, really interesting, and for example, nurses and store managers, there's still also people who are right at the bottom rung of the ladder where they're going to really struggle in terms of flexibility that works for them rather than employers, whether that's people who are somewhere further on in the supply chain or beyond. So lots of reasons to be cheerful and optimistic, but let's not, gloss over the size of the challenge that we face going forwards. And I'll hand back to Claire.
Lovely. Thank you, Ben, and all our speakers. Really such a rich feedback, rich insights, positive findings, but as Ben said, still some way to go when we look at the bigger picture, but we're absolutely on the journey, and you can see the station that's coming and the tone of some of the messaging out there that change is coming. I'm going to have time for a few questions. I'm looking down the chat. There was one, Andrea, I wanted to come to you around tracking over time, and you talked there about kind of some of the impacts you've seen. So there was a question just kind of, are you going to continue to track positive impacts and make sure that these stick long term?
Yes, absolutely. I mean, we will continue to track the impacts, and we will continue also to roll out self-rostering and team rostering, because we've seen the benefits to our staff and also the benefits for our patients as well. So absolutely, Claire, will continue to track and also make visible the benefits to the organisation of flexible working, because as Ben has mentioned, we aspire to be an organisation that's flexible working by default. Which hasn't been the perception of Guy's and St Thomas's in recent years. So yes, absolutely.
Lovely, thank you. And Louise, there was a question, and I'm sure you've seen around kind of how this affects shop floor staff. So they're kind of, and there's another one about line managers. So I know you were looking mostly at store managers, but what's the sense of the impact kind of higher up and lower down in your organisation as well?
Yeah, so our store colleagues at the moment already get quite a lot of flexibility actually in the way they work. So I think the challenge there comes down to really good conversations about scheduling and rostering at a local level, making sure that they're seeing those in advance as well and having input into them. So we already do a huge amount of that anyway, and it's just making sure that our line managers continue to do that, because that then provides our colleagues with flexibility. In our distribution site, that's slightly more challenging because of the use of PPE equipment and how productive we need to be with that. But that's some of the challenges we're working through now, actually, and we've just been through piece of work to listen to them about ideally what they're looking for from flexible working. School hours has been a big one that's come out of this. So we are at the moment looking at how we manage our shifts and our PPE equipment to make sure that we can allow for much shorter shifts so that colleagues can do school hours. So we're sort of exploring that for our distribution sites at the moment.
Lovely. Seeing what's possible. Thank you. There's a question around flexible working and complementing the call for stronger minimum sick pay and some of the other legislation that may positively impact low paid and minoritized workers. Sarah, can I bring you in on this one? Did you have any reflections?
Yes, just to say, completely agree about improving sick pay and from day one. So hopefully that will be in the raft of reforms coming very soon. But just to share, one of the insights from our programme was that people felt that they wouldn't need to take sick leave as much if they had increased flexible working. So one of our recommendations is really for employers to really monitor the relationship between the two, because there is a relationship. and Astrid might remember the stats in more detail than me, but certainly at Sir Robert McAlpine, we did see a pattern of people taking sick leave who otherwise wouldn't if they had flexible working. So whether that means just being able to have a shorter day, you know, work from home sometimes, not have the pressures of being on site, if that is an option, you know, different options. And again, those conversations around what that flexibility might look like. But yes, something to track, but not to disassociate from flexible working.
Thank you. There's a question here about did we capture any data on line managers' perceptions of the impact of the changes? Astrid.
We did speak to line managers. We also did the surveys actually also went to wider colleagues as well as managers, as well as beneficiaries. So we got sort of feedback from multiple angles, but certainly through the focus groups in particular is where we got some line manager feedback, and it was generally very supportive and positive around performance and being maintained, and really positive feedback that we got.
Okay, good. So they weren't, because we sometimes hear that when staff have more flexibility, it makes the manager's job harder, but you didn't kind of.
Yes, well, certainly these changes weren't without challenge, as we've already heard from everybody. There was a sort of challenge involved in these in an investment required from the managers in terms of their time and effort and system changes and different thinking around it. But I think the pilot process really enabled them to see what was possible and reassure themselves about what the long-term outcomes were going to be.
Yeah, lovely. Thank you. Ben, there's been a question, what other sectors could these changes work within? And, you know, are there any sectors you think are kind of ripe for innovation around work quality and fair and secure work?
Yeah, absolutely. I mean, I think where the government will go is on the social care sector, and we've heard quite a bit about potentially having additional collective bargaining around, well, not even additional, but some collective bargaining around adult social care, and I think that would be, you know, that would kind of emphasize this point that we need better integration between health and social care. Clearly, you know, they're very different sectors in some ways at this particular point in time, but also some of the highest levels of job insecurity are in the adult social care sector. But again, demand for social care is only likely to rise over the coming years, but staff retention is a really huge issue. So I think there's a very big case to start with the social care sector and see how we go. Again, that will be about national government working with local government who have the responsibility to deliver care, but also with businesses and employers as well. Yes, I think social care would be a really good place to start with some of this.
Yes, thank you. Andrea, a couple more questions. I think obviously you talked in your example about people getting the chance to choose their shifts, but a couple of questions about part-time, reduced hours working. You know, are those options possible as well?
Yes, they are options. NHS England really helpfully produced a really good visual, and I'll send it to you, Claire, separately, because I think it applies to any organisation with shift working. And what it did is it very clearly visualised the various types of flexible working. So you can work part-time, job share, hybrid, remote, team roster, self-rostering. So there's a variety of ways of flexible working. And so job sharing and part-time working is also a part of our flexible working policy.
And that's possible in nursing. I know a lot of people get hung up on the 12.5-hour shifts, but it is possible to make part-time work.
It is, and we do have nurses that work part-time. I mean, in one of the pilots that we ran, the flexible working time was reviewed and discussed with the team that fully supported to be rostered on long days. And so they worked out the proposed working time, which was from 8 a.m. to 7 p.m. for 3 days, and then one short shift, 8 till 4, and a day off during the week. And there was rotation on who takes Fridays off, and 2 day weekends and a Monday off, so 4 days off. in a row. So these are the principles that the team worked out to ensure that they could work flexibly, and it worked for the patients as well as for the individuals.
Thank you. I know that's really important work there, and I think increasingly we're looking with NHS England and others about again the evidence around how this all links to patient outcomes, as you've touched on there. And, you know, as well as the worker health, the patient health becomes really important as well. And I think you know, the case is growing for there being a link there as well. Absolutely. Lovely. Okay, conscious of time, so I'm going to have to draw things to a close there. Thank you for all the questions. We might get back to a few of you with the ones that we weren't able to answer. A big thank you firstly to all our speakers for their time this morning. It's been really great to hear firsthand your experiences and thoughts about the study. So everyone on the call will be sharing with you a link to the report and to the video, the full video and the mini video that we made, which gives you the real worker experience and how they felt about everything that they've benefited from through the course of this study. Do feel free to share, you know, the report, the video. We'd love to see it out there because we want to reach as many employers as possible with a message that flexibility is for all. I want to take this opportunity to thank our supporters, Impact on Urban Health. Nicola Bristow there in particular has been a great partner to us and to the employers who took part. We appreciate it's been a long journey for all of us. So it's been an absolute delight to go on it all with you. A couple of brief plugs for Timewise projects to keep an eye out on. Where are we going next? Firstly, we have another project running to really build on this concept of fair, flexible futures. And we've been working with industry leaders, with sector bodies, with some of the key employers in construction, health and care, retail and transport to look at where they are as a sector, what their challenges are around fair and flexible work and how to progress and move forward. So reports coming there in the autumn, so watch this space. And you may also have seen, and I know he's popped up in the chat a couple of times, we are partnering with Joe Ryle at 4-Day Week campaign on their latest trial. So if anyone has thought about dabbling in reduced hours working, could be 9-day fortnights, could be compressed hours, could be 4-day week. We're kind of open to a range of flexible options and kind of onboarding employers now for a trial in the autumn. So if it's something you've been thinking about, great time to think about embarking on that, and there's more information on our website or on the 4-Day Week campaign website. So I hope we've given you food for thought today. Thank you for joining us. We will continue to kind of make the case that flexible working matters, not just for individuals and their well-being, but for organisations and their success. So help us spread the word, and many thanks for joining us. And the sun seems to have finally come out here. Enjoy the rest of your day.
Thank you. Bye-bye.